We are very happy to be here. We know that TB is a big problem and HIV is a big problem, but the two of them together is particularly deadly and challenging. This is such a hard problem in children and in families. So we're very grateful because the Elena Pinchuk Anti-AIDS Foundation has helped support this symposium to bring together experts not only here in Ukraine, but also from around the world to help us both in diagnosis and treatment. We have to do better. These children and these families suffer very greatly, but there is very, very good treatment. But it can be difficult, it can be challenging. So what is the newest in terms of diagnosis? What is the best in terms of treatment? So we're here together to say, how can we treat children better that are facing both of these terrible diseases? These infections get worse unless there's a focused effort to treat both of them. So at Brown University, we both have an HIV program and a TB program that work together hand in hand. And we found that unless we're working together, we can't treat them both well. If someone just treats the HIV or someone just treats the TB, then we have problems. But when they're treated together, we can see the greatest impact in terms of particularly children, but also families. This is a family disease. If a child has TB, maybe a parent has TB. And as we know, if a child has HIV, there's high likelihood that a parent has HIV. Ukraine has a severe crisis. It not only faces TB rates which are very high, but drug-resistant TB. And this is a great concern for us. Some patients are diagnosed with TB, and even at the very beginning, the TB is resistant to many of the medications. There are other medications that will work, but you have to know it. And this is a great challenge. There is lots of information and awareness related to HIV. Still, treatment is difficult. We need better and better treatment. But there's lots of awareness, and there's less awareness of TB. So we hope with this conference to increase awareness and improve treatment for both. The TB and HIV epidemics continue in all different parts of the country. Many of the clinics are fantastic. Many of the physicians are very, very, very dedicated. But we hope to be able to provide some of the tools. There are new diagnostic tools, which are very exciting, and new treatments. When I started to take care of my first patient with HIV, we had no good treatment, and our patients all died. I have seen our treatment get so much better. So now I tell my patients in my clinic that with the treatments we have, they should be able to take care of their grandchildren 30 and 40 years from now. This gives hope. Phenomenal hope. And yet, in many parts of the country, that is lacking. Patients don't believe it. And many of the physicians and care centers are struggling because of the terrible burden of HIV and TB. If we can give a small help with this, that would be a wonderful thing. This is a great country. My wife is Ukrainian from her background. One of my children was adopted from Ukraine, so I love being here. It's a wonderful thing. So anything we can do to help is a great pleasure for us. And we learn. It makes, this is bilateral and is a big benefit for both of us.